Assalamualaikum.
Waalaikumsalam, Doktor.
Yes, hear me. Boleh dengar jelas Okay, alright.
Boleh.
Let me set up my slides. Okay. Okay, alright. So the first thing I would like to apologize for rescheduling the session several times, but yeah, that's nothing much that I can do. And then I was hoping to finish both lectures this morning, but we'll see how it goes. The things I have two very unwell patients in the ICU, so just hoping we can finish even at least one. Okay, all right. Let me see. Okay. Can you see my slide?
Yes, can.
Okay, all right. So we'll do one first. Prematurity and its complication. Last time we talked about what was the topic we discussed before? Birth asphyxia, is it?
Birth asphyxia.
Okay, all right. So today we're going to talk about prematurity and its complication, and the other topic will be the adaptation to extrauterine life, which actually the last topic is actually the most important. Okay, all right. Okay, so there are several things that is important for you guys to know and understand. Okay, so which babies we define as premature babies? So premature babies are those delivered before 37 weeks completed gestation. So those from until 36 plus 6 is considered as premature. After 37 weeks, then we consider the baby as term. There was a time when we look at 38 when we consider as term, but now generally we say that 37 plus 0 is actually term baby. So those until 36 plus 6 is considered as premature babies. And this is just in terms of how you define prematurity. I'm not talking about the survival yet. If you look at survival, if you look at survival in Malaysia, for example, most hospital, including SASMEC, we, in terms of survival of the baby, we take as 25 weeks period of gestation, meaning those babies who are born more than 25 weeks, we consider them as viable, and these babies are the ones that will be resuscitated and will try and save the baby. But babies who are born before 25 weeks, my 24 plus, generally they don't survive, and some of the times we don't even attend. So neonatology, pediatrics team don't even attend. So we allow the baby to pass with tender loving care, so with the mother. So that's what we do. In Malaysia, 24 weeks and above, so 25 weeks is the survival, the viability punya gestation. 24 to 25 depends on the discussion. We'll discuss with the mother, we'll tell the mother the high risk of long-term neurological sequelae. We explain to the mother the need for prolonged admission, and so if the parents agree, and then we assess condition of the baby at birth. If the baby shows some signs of life, then we'll try and save the baby. We'll try and get the baby to NICU. But if the baby at birth doesn't show sign of life, then we don't proceed with anything. So that's one thing. That's in Malaysia. In some hospital in Malaysia, even some major hospital in Malaysia, they take 27 weeks. Maknanya those born after 27 weeks baru kita consider dia viable. Before that, the babies will die with the mother. Macam tu. In more developed countries, when I was working in UK, for example, and most of the countries in the world actually, they take 24 weeks. So those born 24 weeks and above, these are babies who should survive. So 23 to 24, according to the discussion with the mother, and also based on the baby's condition at birth. Macam tu. In more developed countries, the more neonatologically advanced countries such as Canada, Japan, so they take up to 22 weeks. So 22 weeks and above, they consider as viable. So that depends on the country, the setup, and so on and so forth. So Malaysia is still, we are still far away from the developed countries. We don't have enough neonatologists. We don't have enough expertise. We don't have enough nurses with proper neonatal training. We don't have enough NICU. We don't have enough NICU bed. We don't have enough ventilators. Our neonatal care in Malaysia is actually quite in shambles, like, if you ask me. So we are so far away. We are so far away. Okay. So the more premature the baby is associated with more mortality and morbidity as compared to full-term infants. The lower the GI, the more complications that can happen. So the other things you need to know that, so we classify as premature, less than 37 weeks. There's late premature, 34 to 36 weeks, moderate premature, very premature, and extreme premature is actually if it's less than 28 weeks. That's considered as extreme premature. Low, if we look at birth weight, those LBW are those born less than 2.5 kilos. VLBWs are those born less than 1.5 kilos, and ELBWs are those born less than 1 kilo at birth. And then this is the general weight that we can see, but it's not fixed like that. It depends on the baby, depends on the nutrition, depends on the mother, so on and so forth. So generally in the United States, for example, those VLBWs, ELBWs accounts for 0.7% of live birth, and 99% of them are premature. And then basically VLBWs account for 7.2%, and those more than 2.5 kilos accounts for 92%, and only 7% are premature babies. And premature babies and birth weights, they have overlapping with birth defects. Okay. The thing is, if you look at newborn babies, if you look at premature babies, the cost of looking after them is very, very high. For example, if a baby, so if you admit a baby, if you admit the premature baby, how long would you expect the baby to stay in the hospital? So most of the time, we should counsel the parents that you should expect the baby to be in the hospital until around the time the baby is supposed to be born. Maknanya, if the baby is born premature 30 weeks, 30 minggu, kan? So maknanya the baby is born early by 10 weeks. 10 weeks maknanya lebih kurang berapa? 2.5 months. Kan? 2.5 months. So we need to counsel the parents. The baby probably will stay in the hospital around 2 months plus. So that's the thing. And staying in the hospital for 2 months plus, there's a lot of cost involved. There's ventilation, there's cost for surfactant. Surfactant is almost 1,000 ringgit per vial. And then sometimes we need to give immunoglobulin, which the price is around 1,300 per vial. So a blood transfusion, which is also expensive. So there's a lot of charges, and sometimes we keep patients for a very long time. I think the longest I've kept a patient was until the child, from birth until dia umur, I think 1 year and 6 months. So 1 year and 6 months, can you imagine? We kept the baby in the hospital for 1 year and 6 months, and there's a lot of issues, lots of complications, and then mother separated from babies, mother baby separation is among the triggers for postpartum psychosis, postpartum depression. For example, I've had one case where the mother actually attempted suicide. Well, not attempted lah. The mother actually did suicide because of postpartum psychosis. So because of separation. So these are the things. There's a lot of costs involved. If you look at, I think last time we had one baby who we admitted in Susmek from birth until around 3 months. The total charges for the patient, this was, sekarang ni kan Susmek kan everything is free. We give 100% discount for children. But there was a time initially we charged for everything. So I've had one baby who was admitted in Susmek for 3 months. The total charges for that patient was, I think, 50,000 plus. So 50,000 ringgit for 3 months stay. So can you imagine who can afford that much of money? And who can afford that much of money? So kalau assistant professor punya gaji, that's 5 times the monthly salary. So obviously is very unaffordable. We've had babies before who were premature, just borderline premature. Both they're twin, MCMA twin, very low birth weight, and was born at 32 weeks. So patient was actually booked in HTAA, but they don't have bed at the time, so they transferred the patient to Susmek. They was born in Susmek, admitted, but I think we discharged after around 1.5 months macam tu. And they're from very low socioeconomic status, lived in Maran. The mother is a housewife, father is a undertaker. So bapa dia penggali kubur. So the income was very, very low per month. But the total charges, this was a time when we charge patients. We don't give discounts at that time yet. But the total for 1.5 months for those 2 babies, for each baby is almost 20,000. So for 1.5 months. So the cost is very, very high. The cost is very, very high. And this cost must be backed by someone. Someone need to pay. Whether it's the government, whether it's the insurance, whether it's the university, so someone needs to pay, or out of pocket. Like the premature I told you, they were from Maran, and each time they want to come for review appointment in clinic, they only ride motorcycle. Ayah dia ada motorcycle saja. So daripada Maran, dia ride motorcycle, mak dia pegang both twins macam tu, datang follow up. So can you imagine? So it's the cost and the issues with them is so very high. Even if you look at other countries, if you look at UK, for example, dekat UK, the system is there's no government hospital. Dia ada NHS punya, each hospital is a trust, yayasan. Each hospital is a trust. And each hospital, dia akan ada patient yang government punya patient, which is NHS punya patient, ataupun yang private punya patient. So private punya patient sama ada patient yang bayar out of pocket money, ataupun patient yang ada insurance. But kalau NHS punya patient, the charges will be borne by the government, NHS, National Health Service. So the charges is almost the same actually. So setiap patient, all patient yang admitted to the hospital, kalau di NHS punya patient, the hospital will charge the government. If I were to put a number, for example, in UK, for a baby who's admitted to NICU, needing NICU level of care, generally the charges for them is £1,300 per night. 1,300 British pound per night. Maknanya kalau kita tukar duit Malaysia tu berapa dah? Almost 10,000 ringgit per night. Can you imagine? Kan? Kalau dia level HDU level of care, usually is around 800 to 1,000 British pound per night. Kalau di level SCN, special care nursery, usually is around 500 British pound per night. And kalau dia transitional care, is around 200 to 300 British pound per night. And again, sometimes we keep patients for almost 1 year. So can you imagine how much the cost is being borne by the government? So it's very, very high. Someone needs to pay, and all this comes from taxpayer. Wait, yeah. Let me see. Okay, all right. Okay. So, what are the conditions leading to premature birth? Well, you should learn this already in ONG. So there's a lot of issues that leads to premature delivery. So it can either be spontaneous or it can either be clinically indicated. Spontaneous, such as those spontaneous preterm labor, PPROM, multiple gestation. The more babies, the more higher risk of leading to premature delivery. Cervical insufficiency, and then those clinically indicated mother or fetus at risk. For example, those with COVID mothers, or mothers with eclampsia. So any diseases, any condition in the mothers. So preeclampsia, for example, fetal distress, IUGR, if the baby is not growing, Doppler is abnormal, then probably we need to deliver the baby early, because if the baby is not growing, it shows that the baby is in distress, the baby is in stress. So if you don't deliver the baby soon, the baby will actually die in utero. The baby will actually die in utero. Abruptio placenta is another cause for prematurity, and fetal demise is another reason for this one. And usually premature birth is associated with several demographic characteristics, such as those of extreme ages. Extreme ages maknanya mother dia less than 18 years old or almost 40 years old, low socioeconomic status, unmarried. Okay, all right. The known continue with the other known risk factors. So inflammatory diseases in the mother, systemic diseases, diabetes, SLE, lupus nephritis, those kind of things. Infection in the mother is a known cause for premature delivery. COVID is a known cause for premature delivery. COVID generally doesn't affect the baby as much, but COVID is a known cause for premature delivery. And those babies with those infants whose mother has COVID, they are associated with more severe RDS, respiratory distress syndrome, for example. And then when there is overdistension of the uterus, such as the multiple pregnancy, overdistension because of polyhydramnios, any uterine abnormalities or cervical abnormalities. Okay, all right, we're not going to go there. Okay, and what are the morbidity of prematurity? What can happen to the babies? What can happen to the babies? Again, prematurity means the whole body, the whole system is premature. The whole system, from head to toe is still not ready to be born yet. We remember certain things are still developing. Our brain, for example, and a human brain develops until around 2 years old. After 2 years old, generally it's not developing anymore, it's growing. Before 2 years old, so only kita punya brain tu, it develops until around 2 years old. After 2 years old, generally it's not developing, it's growing in size. Tapi before 2 years old, dia still developing. Banyak parts yang still nak form, banyak parts yang still nak build, and so on so forth. Sebab tu, for example, children yang ada cerebral palsy, we do not diagnose cerebral palsy below 2 years old. Sebab masa 2 years old ni, they're still in a developing brain. So after 2 years old, it's not developing anymore, it's growing. So that's the thing. So after 2 years old, baru kita label dia as cerebral palsy. Below 2 years old, the most kita boleh kata is evolving cerebral palsy. Sebab certain parts of the brain is not even formed yet. They're still developing, still nak form certain parts of the brain. Sama juga dengan other structures, contohnya our lungs. Our lungs ni umur berapa baru dia develop? Our lungs actually develop until around 18 years old. So certain parts of the lung are still not formed yet. If the baby is born before, for example, before 26 weeks, before 26, 28 weeks, sometimes even the alveolar are not formed yet. So gaseous exchange happens at the level of the terminal bronchioles. And so the lungs are still developing. surfactant, for example, surfactant production occurs around 34-week period of gestation. Kan? So banyak benda yang still not developed yet. For example, apa lagi? For example, sucking. Kita fikir sucking ni easy kan? Nak makan, nak suck, kita fikir is easy. We think is easy. But sucking actually needs a very mature punya neurological system. Your nervous system, your neurons must be very mature. The muscles must be strong enough. That's why sucking stimulation and sucking actually appears around 34-week period of gestation. So babies who are born before 34-week period of gestation, usually they don't know how to suck. So kalau baby is born premature, less than 34 weeks, generally most of the time they cannot orally feed. They cannot feed by oral. Kita kena pasang rice tube. We need to insert nasogastric tube or orogastric tube, and then we feed by the tube. And then around 34 weeks, we start to train the baby. Kita ajar dia balik how to suck, how to swallow. We retrain the baby. So that's one thing. So banyak benda yang belum develop lagi. Banyak benda yang belum develop lagi because it's still developing. It's still developing. The ductus arteriosus, for example, is not closed yet. Nanti kita akan discuss pasal ductus arteriosus in the adaptation to extrauterine life. You'll understand better. But the thing is, the ductus arteriosus usually it will close with the increase in oxygenation. When the baby has the first cry, kan, ductus arteriosus akan mula close. Usually it takes around 5 to 7 days baru ductus arteriosus dia properly close, kan. Sebab tu contohnya yang ductal dependent cyanotic congenital heart disease, usually they don't appear before day 5 of life. Sebab masa day 5 of life ni dia punya ductus arteriosus dia still patent, so dia tak nampak all the kind of problems. So the moment the ductus arteriosus close, baru kita akan dapat the problem. Dia akan jadi more sinus, dia akan jadi more tachypneic and so on and so forth. So things are still developing. The heart is still developing and so on and so forth. So the earlier the baby is being born, the more problems that we'll see. And the problems are from head to toe. Problems are from head to toe. The brain is still immature. Bila dia brain is still immature, blood vessels in the brain, they are very friable. They're very friable. They're very fragile. So apa jadi, dia boleh bleed. Bila dia bleed, dia senang bleed. Bila dia bleed, apa jadi? Bila dia bleed, dia akan dapat IVH, intraventricular hemorrhage. Banyak vessels yang tak properly pattern, so banyak areas stand ada risk untuk dapat hypoxic insults. Dia akan jadi periventricular leukomalacias. Kan? The eyes are immature. Mata dia pun immature. Bila the eyes are immature, especially if we give more oxygen, what happens is the eyes can get problematic. They can get retinopathy or prematurity. The mouth is still immature. The nerve supplying the oral cavity is still immature, so they don't know how to suck. They may have problem with feeding because they don't know how to suck. Sometimes they don't know how to suck, they don't know how to swallow. And some babies after 34 weeks, they can suck, they can swallow, but there is sucking, swallowing discoordination. So dia boleh suck, dia boleh swallow, tapi dia tak boleh nak coordinatekan between sucking and swallowing. Lepas tu dia punya GI dia tu, the gastric sphincters, the sphincters of the stomach, the cardiac, kita punya sphincter kan ada dua kan. Kita ada pyloric sphincter, kita ada our cardiac sphincter. So sometimes the cardiac sphincters are still immature, the muscle are very soft, it's not strong enough. So there's a risk of getting diseases such as gastroesophageal reflux diseases. So it's quite common in premature babies. Kan? Lepas tu dia punya tissue lining the bowel are immature, they don't have the normal gut flora. Kan? Dia tak ada the probiotics, dia tak ada the normal gut flora. They are then the tissue linings are very immature, very fragile, so they are at risk of developing necrotizing enterocolitis. The heart is immature. Bila the heart is immature, the muscles of the ductus arteriosus is not strong enough. Bila dia not strong enough, even with oxygen, the ductus arteriosus do not close. Sebab muscle dia tak kuat. Bila muscle tak kuat, dia tak close. So they can have problems such as patent ductus arteriosus macam tu. So the whole body is immature. The lungs are immature. The lungs are immature, as I said before 28 weeks, usually alveolar pun tak ada. Gaseous exchange happens at the terminal bronchioles. Before 34 weeks, they don't have enough surfactant. Bila tak ada enough surfactant, apa boleh jadi? Dia boleh dapat surfactant insufficiency, dia boleh dapat respiratory distress syndrome, which is RDS, ataupun hyaline membrane disease, which is the same thing. Because of surfactant insufficiency, surfactant dia tak cukup, surfactant deficiency, because of the type 2 pneumocytes are not producing surfactant lagi. Dia punya kidneys are immature, so they tend to get more problem with the kidney. So this is top to toe punya problem. Dia punya liver are still immature. Bila liver dia still immature, satu apa? Liver dia boleh dapat coagulopathy or prematurity, sebab liver dia still immature. And then storage, because many things are stored in the liver. Your glycogen are stored in the liver. If they are born premature, they don't have enough glycogen storage. So they tend to get more problems such as hypoglycemia and so on and so forth. Iron are stored in the liver. If they are born premature, they don't have enough iron storage. So they tend to get anemia or prematurity. The bone marrow is immature. Bila the bone marrow is immature, they are not able to produce blood adequately, so they can get anemia or prematurity. They can get thrombocytopenia. The immune system is immature. Why? Because the bone marrows are not producing enough white blood cells, and they don't have enough antibody. So antibody wise, one thing, our white blood cell must be able to produce IgM, IgG, IgA, and so on and so forth. So IgG and IgM. So bila ada infection, kita produce IgM mula-mula kan. Lepas tu kita produce IgG. The thing is, the more premature the baby, the less capability of the white blood cell to produce IgG and IgM. So that's the problem. So that is why premature babies, they don't have the macam blood transfusion reaction macam more bigger children. Sebab the body doesn't produce all the kinds of antibodies. They don't produce antibody. Itu nombor satu. Nombor dua pula, how can they get antibody? They get antibody also from the mother. Yang satu, body dia not strong enough, not mature enough to produce antibody. Number dua, they should get antibody from the mother. Kan? By mana? By the satu, dari transplacental transfer. Daripada antibody daripada mother, transferred to the baby through transplacenta. The problem is transplacental transfer of antibodies usually happens a bit later. Happens around 15 to 17 weeks of life. 15 to 17 period of gestation. Before that, they don't transfer. So if the baby is born premature, they don't get enough immunoglobulin from the mother. And what type of immunoglobulin they get? Usually the transfer is IgG, because IgG is smaller molecule as compared to IgM. IgM is larger punya size, so they don't usually pass through the placenta. Certain IgM do pass through. Contohnya macam dengue IgM. So dengue IgM memang boleh pass through. So if they are born premature, they don't have enough immunoglobulin from the mother. They also get immunoglobulins from the breast milk by the IgA, secretory IgA, which is secreted in the breast milk. But if they're born premature, they are not feeding well, they are kept nil by mouth, they are separated from the mother, so they won't get enough secretory IgA from mother's breast milk. That is why having proper milk bank is very, very important. It's very, very important. And apalagi dia punya skin. Skin is the first defense mechanism. Kita punya skin ni very important defense mechanism. It prevents infection. Dan kalau ada skin break, boleh dapat infection. Bila ada skin break, any skin break, any puncture through the skin, is risk of infection. The thing with newborn babies, the more premature the babies, the skin are more fragile, more friable. Skin dia senang break, very shiny, very fragile type of skin. So skin dia senang break, senang dapat infection, very thin layers of skin. So easy to get infection by the skin. Lepas tu pula premature babies, generally many of them they are admitted in the ward. Bila dia admitted dekat NICU, what happens? They are more exposed to satu, bila dia admitted, dia tak dapat the normal gut flora tu, they don't get the normal gut flora. The other thing is they are exposed to more problematic infection, the more nosocomial, hospital acquired infection, which is more problematic. Lepas tu pula dia masuk ward, kita ambil darah banyak kali. If you can imagine kan, this is idiopathic punya anemia kan. If you can imagine, blood volume in a human being is 80 mils per kilo, 80 mils per kilo. Kan? That is normal blood volume, the whole body. Okay, if you imagine you have a baby who is only 0.5 kilo, 500 grams saja. So berat baby tu 500 gram. So the total blood volume in the whole body of the baby is only 40 ml, only 40 ml, 40 mils saja. So if you take blood, kan, for example, you ambil blood gas. Blood gas minimum is 0.5 ml. You ambil full blood count pun 0.5 to 1 ml. You take BUS, RP, it takes around 0.5 ml as well. Kan, kalau you nak ambil RP, LFT, CRP, you need around 1 ml of blood. Kan, you nak ambil coag profile, PTA, PTINR, you need around 1.5 ml. So can you imagine how much blood we need to take? And sometimes we take blood gas every 6 hours. Other baby we need to take blood gas every 2 hours, for example. So setiap kali kita ambil 0.5, 1 ml, sekali ambil 2 ml. And the baby only has total of 40 ml blood. 40 ml saja blood dia total. So they are at risk of anemia, for example. So these are the things that can happen to them. Okay, so at neonatal period, these are the problems as I've mentioned before. Short term, in the short term, feeding and growth problem because they don't have enough reserve. They are admitted in the hospital. They don't get enough adequate nutrition, for example. Risk of infection because we put lines lagi kan. Kita pasang line, kita pasang granula. Kan, even the peripheral lines are higher risk of infection. Sebab itu the moment kita tak guna, we need to remove the peripheral line. This is about peripheral line. Central lines has higher risk of infection, PICC, long line, higher risk of infection. Femoral line, higher risk of infection, and so on and so forth. And they may have neurodevelopmental difficulties, retinopathy or prematurity, and some of them have transient dystonia because of the immature neurological system. And long-term prematurity is among the known cause of cerebral palsy. They may have sensory deficits such as deafness, for example, kan? Blindness, for example. So there's a lot of things. They may need special care, special healthcare need. They may have problem with incomplete catch-up growth. Even things like autism. Prematurity is associated with autism. And some of them may have chronic lung diseases or even gastroesophageal reflux disease. So when we look at the babies at birth, premature babies, for example, kan, kita tengok dia punya sole dia, tapak kaki dia is more flat. As compared to more term babies, kita akan nampak crease dia. So kalau premature baby, kita akan nampak flat saja. Dia punya breast dia, for example, dia breast bud. In term baby, kita akan boleh rasa the breast bud, kita akan nampak ada protuberance. Tapi dekat more premature baby, sometimes it will be flat saja. Dia tak ada breast bud pun lagi. So these are among the things that we assess. Dia punya testis dia sometimes is undescended. Dia tak ada nampak ruge yang banyak. Ni ada sikit-sikit ruge ni. The more premature the baby, the less ruge that you'll see. Ruge ni yang kedut-kedut tu. And then in females, the more premature the baby, the labia minora is bigger than the labia majora, for example. So when the baby is being born, dia ada assessment yang kita boleh buat. Ada assessment yang kita boleh buat yang kita boleh tahu actually berapa gestational age dia. Kan? Ni kita kena buat. Usually we need to do within the first 24 hours of life. Ni yang mula-mula. So scoring dia, kita score -1 to 5 dan kita akan tambahkan. So posture, kita tengok posture baby tu macam the more premature the baby, dia akan more flat macam tu. The more mature the baby, more term the baby, dia akan ada banyak muscle tone. So bila muscle tone dia akan flex kan. Square window, the more mature the baby, dia punya lagi senang nak flex dia punya wrist dia, arm recall, popliteal angle, scarf sign kan, scarf sign, and then heel to ear. So ni yang kita assess, dan kita tengok physical dia pula. Ini pun samalah, -1, ini 5. Kan, skin dia macam mana. Kalau more premature baby, skin dia sticky, friable, transparent, boleh nampak vessel macam tu. Macam bidadari kan, telah Elio nampak kan. So kita boleh nampak very transparent punya skin. Kan, kalau more term baby, kulit dia macam leathery, ada crack, ada wrinkle and so on so forth. Parchment, dan nampak deep cracking vessel and so on so forth. Lanugo ni actually bulu badan kan. So the more premature baby, kita akan nampak dia abundant sparse. Kalau macam yang more term baby, dia akan nampak ball, dia tak ada nampak dah lanugo tu. Crease, and then breast bud, and then dia punya ear dia kan. Kalau term baby, kita lipat dia punya ear pinna dia akan ready recall. Dah rasa stiff dah, for example. Instant recall, ready recall, ataupun memang stiff, keras dah rasa. Tapi kalau more premature baby, kita lipat telinga dia tak patah balik, dia tak full balik, dia tak recall balik, dia lipat macam tu je sebab dia very soft. Kan? And then genital dia. So kita tambahkan. So ni contohnya ni kosong kan, ni satu campur semua, yang ni dengan yang ni kita campurkan dan kita tengok skor dia. So kalau skor dia 20 for example, dia akan dapat 32 weeks gestation. Kalau skor dia 18 for example, so maknanya dia in between dia. So dia 30 to 32 weeks period of gestation. So ballot score is a very good indicator of what the actual gestational age of the baby is. Sebab sometimes mothers dia tak ingat dia punya exact last menstrual period, dia tak ingat LMP dia. Or sometimes juga, especially in Malaysian, Melayu punya culture kan, I've seen before yang mana dia tipu dia punya dia punya LMP tu. Sebab ada orang tua-tua bagi tahu kata, jangan bagi tahu doktor yang betul, kena tolak 2 minggu ke macam tu. So kadang it's not correct. So that's why we need this. So it's a very good indicator. So for you students kan, one thing interesting that I think is interesting, I believe is interesting. So I had a discussion with the previous Timbalan Mufti. Sekarang Timbalan Mufti dah Timbalan Mufti baru kan. Sekarang Timbalan Mufti is siapa nama tu? Ustaz. Allah tak ingat siapa nama. Tapi I had a discussion with the previous Timbalan Mufti. So he asked me, sebab dekat Pahang ni, if a baby is being born less than 6 months before less than 6 months after marriage, then they consider the baby as anak luar nikah. So that's the thing. So they asked me, is there any clinical way how to assess whether the baby is actually betul-betul anak luar nikah ke tak? So I told him, the thing is we have this ballot scoring. Contohnya lah kan, kalau the baby is being born at 6 months, kalau ikut yang fatwa negeri Pahang, 6 months maknanya dia consider as anak sah taraf lah kan, sebab 6 months maknanya 6 months dia survive. The thing is, if when we do the ballot scoring, the baby is actually term kan, so probably it's actually premarital punya conception. So actually we can know the time of conception based on ballot scoring. So that's one thing lah, that's one thing. Okay, next is respiratory. So sometimes, as I mentioned before, because the lungs are immature, they don't produce enough surfactant, so they can get respiratory distress syndrome or hyaline membrane disease. They are at high risk of pneumothorax because the lining of the airway is very fragile. sometimes we do need to give oxygenation, we give bagging, positive pressure ventilation. There's a risk of getting pneumothorax. They are at high risk of getting congenital pneumonia because they have more weaker immune system. They are at high risk of getting apnea. So apnea or prematurity. Apa apnea or prematurity is because the immaturity of the cardiorespiratory center. So in your pons, cut your brainstem to your pons, you remember this is the first week lecture in your year 1, kan? You learn about the cardiorespiratory center dekat your pons. Dia trigger kan bila your CO2 level goes up, oxygen level goes down, the receptor at your carotid body and aortic body will send signal to your pons. Your pons dekat ada cardiorespiratory center dekat your pons, and this will trigger the breathing. So the thing is, the pons in premature babies are very immature. So bila dia immature, they don't fire, they don't trigger. So sometimes premature baby, they tend to forget how to breathe. They tend to forget to actually breathe. So dia dapat apnea or prematurity. So that is why, so usually this center is mature enough after 34-week period of gestation. So before the age of 34-week period of gestation, sometimes this baby may need something to stimulate them to breathe. For example, apa kita selalu bagi? We used to give things like caffeine. Caffeine yang ada dalam coffee, tea, and so on and so forth. So we give caffeine to the baby. So caffeine is a stimulant, so it will stimulate the cardiorespiratory center to trigger. So that's the thing. Sebab tu bila you minum coffee kan, your heart rate increases. Sometimes if it's too much, you tend to breathe a bit fast. So all this is because of the stimulation effect of the caffeine to your cardiorespiratory center. Okay, next is cardiovascular patent ductus arteriosus, as I mentioned before, because the muscle lining the ductus arteriosus is immature, it's not strong enough. So when they contract, they are not able to actually close the ductus arteriosus. They tend to get patent ductus arteriosus. The left ventricles, the heart is still immature, it's not strong enough. They are at risk of developing hypotension. And with apnea, they may get bradycardia. Because why? Because the cardiorespiratory center is not mature enough. It's not firing. It's not stimulating enough. Hematological, as I mentioned before, they can have early or late onset anemia or prematurity because of the bone marrow is still immature. The bone marrow is still immature. The liver is still immature. If you remember, fetal hemoglobin is produced in the liver. In fetal life, the main hematopoietic organ in fetal life, masa baby tu dalam fetal, the main hematopoietic organ is actually the liver. It's not the bone marrow. But the liver is immature. So the liver is not producing enough hemoglobin. So they may get anemia or prematurity. Iatrogenic anemia macam apa? Macam tadi lah kita ambil blood and so on so forth. They tend to get iron deficiency anemia. Why? Because iron is stored in the liver. They haven't got enough iron from the mother. The liver is still immature. They don't have enough iron storage. They tend to get disseminated intravascular coagulopathy. Why? Because of the liver dysfunction and so on so forth. The body is not producing enough. They tend to get the vitamin K deficiency and even bleeding because of the vitamin K deficiency as well. GI, poor gastrointestinal function, poor motility, tend to get things like sucking problem, swallowing problem. They tend to get gastroesophageal reflux disease. And the thing is, they are higher risk of developing necrotizing enterocolitis. The single most important factor for necrotizing enterocolitis is actually prematurity. And necrotizing enterocolitis affects more than 30% of premature babies. And when they get necrotizing enterocolitis, NEC, mortality rate is up to 30%. Mortality is up to 30%. So, and the single most important factor, to reduce NEC is actually breast milk. The single most important factor to reduce risk of necrotizing enterocolitis is actually breast milk. That is why it is very important to make sure premature babies have access to breast milk. So that is why in SASMEC we established the Halimatus Saadiah Mother's Milk Center, the first Sharia compliant human milk bank in Malaysia, the first milk bank in Malaysia, the second Sharia compliant milk bank in the world. So that's the thing. So that's the reason why we need to make sure that premature babies have access to breast milk. And because of the liver is still immature, they tend to get hyperbilirubinemia, either direct and indirect, or direct. And then metabolic endocrine, they are at high risk of developing hypocalcemia and rickets of prematurity. Why? Because of the immature parathyroid hormone, the immature parathyroid gland, because of the the storage of calcium and so on and so forth. They tend to get hypoglycemia because of glycogen storage, because of the metabolism. They tend to get even hyperglycemia and hypothermia, because with hypothermia, what you need your brown fat. So we'll discuss this later when we talk about the adaptation to extra-uterine life, kan? So because they don't have enough brown fat, so they are at higher risk of developing hypothermia. Okay. So as mentioned before, IVH, intraventricular hemorrhage, because of the fragile and friable blood vessel, they tend to get seizures, dystonia, because of the immature brain, retinopathy of prematurity, again because of oxygen, and then because of premature, because of very friable vessels, retinal vessels, and then they are at high risk of deafness, hypotonia, dystonia, and so on and so forth. Kidneys as well. Infection, as mentioned, they are at higher risk of congenital infection, perinatal infection, and even nosocomial infection, because they are admitted, and they are admitted for a very long time. If they stay in the hospital for a long time, they are at higher risk of getting MRSA, Acinetobacter baumannii, Klebsiella, those kind of viruses, those kind of bacteria which are nosocomial, hospital acquired type of infection. So in terms of long term, they are at high risk of recurrent hospitalization. They are at risk of bronchopulmonary dysplasia, chronic lung disease. I hope you know the definition of BPD in babies, chronic lung disease. Retinopathy, I've mentioned before, feeding issues, vitamins and iron deficiency, CNS dysfunction, and so on and so forth. Okay, that's it. Okay, complicated. Macam-macam. Is it complicated? No. So it's just that whatever the function, whatever the system, everything is immature. That's it. Senang dia macam tu. All the functions of the body is still immature. All the functions of the body are not working as well yet. So that's the problem. And it's a head to toe punya problem. Okay. All right. So you won't get premature babies for your final professional exam, definitely. But you can get complications of prematurity. For example, definitely 100%, some of you will get cerebral palsy cases. You will get, because cerebral palsy ni case paling senang kita nak panggil for exam. Kan, exam cerebral palsy je. Cerebral palsy, kita punya reserve patient pun cerebral palsy punya case. We have loads of patient with cerebral palsy. Memang every day, I can assure you, every day of your exam, you will get cerebral palsy punya patient. You will get cerebral palsy for your block exam. You will get cerebral palsy for your final professional exam. Kan? So what was among the discussion? We'll talk about prematurity. What's the cause of the cerebral palsy? So we obviously we need to focus on what's happening now. Dia punya rehab, dia punya current problem associated with cerebral palsy, but we'll also look at whether you know what's the risk factor, why this patient developed cerebral palsy before. So again, as I mentioned before, prematurity is among the most important cause of cerebral palsy. You'll get those kind of things. Okay, all right, clear. I don't think we have time for the second lecture. I'll discuss with Laili. I'm very sorry. Busy.
It's okay, doctor. Later, I'll just get another date lah for the second lecture.
Any question from the group? Hal fahimtum kalami? Ada, tak ada, tidur belaka?
Ada doktor.
Ada lagi doktor. Ada.
Ada, masih bernafas lagi
Ya.
Okay. Alright, okay, alright, fine. I think if there's no question, I hope you enjoy your Ramadan. I hope this Ramadan is better than the previous Ramadan, and inshallah, so we pray for the best. Okay, I think that's it. I do need to rush now. Okay, I'm very sorry for multiple time we need to change things. I'm very sorry for, well, this is the life of a doctor. Unless if you have many backups under you, you have your HOs, MOs, then it's a bit better. When you don't have anyone, you're alone, then you'll be busy. Okay, all right, I think that's it. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam. Thank you doktor.